This video will cover occupational health, focusing on key concepts, hazards, and prevention measures essential for nursing exam preparation. Occupational health, defined by the joint ILO and WHO committee, aims to promote and maintain the highest degree of physical, mental, and social well-being of workers. It also focuses on preventing health issues caused by working conditions and protecting workers from adverse health factors. Workers are exposed to 5 main types of occupational hazards: physical, such as heat and noise; chemical, including dusts and gases; biological, like viruses and bacteria; mechanical, related to injuries and ergonomics; and psychosocial, involving stress and burnout. Temperature is a physical hazard. Heat hazards include hyperpyrexia, exhaustion, syncope, and cramps. Cold hazards involve chilblains, trench foot, and frostbite, which carries a risk of gangrene. Noise hazards can cause both auditory and non-auditory effects. The permissible limit in India is 90 decibels for 8 hours of continuous work. Key terms include boilermakers' deafness and acoustic trauma. Protection includes earplugs and earmuffs. This slide focuses on the topic of radiation, which is an important subject for exams. Radiation safety guidelines are set by organizations like the Atomic Energy Regulatory Board. Protection principles include minimizing time, maximizing distance, and using shielding like lead aprons. Monitoring is done using a thermoluminescent dosimeter badge. Chemical hazards enter the body through inhalation, ingestion, or skin absorption. They are classified as local, causing issues like dermatitis, or systemic, leading to organ failure or cancer. Examples include dusts causing pneumoconiosis and solvents like benzene. Silicosis is a major occupational hazard caused by inhaling silica dust in industries like mining and pottery. It results in fibrosis with a snowstorm appearance on X-ray. A key complication is silicotuberculosis, and prevention is critical as there is no cure. Anthracosis, or coal miner's lung, is caused by coal dust. Stages range from simple coal workers' pneumoconiosis to progressive massive fibrosis. Kaplan syndrome is the combination of anthracosis and rheumatoid arthritis. Asbestosis, caused by asbestos fibers, is carcinogenic and involves interstitial fibrosis. It leads to bronchogenic carcinoma, the most common type, and mesothelioma, which is highly specific to asbestos exposure. The X-ray shows a, quote, ground glass appearance. Bisonosis is caused by inhaling cotton fiber dust in textile mills. It is also known as Monday fever, because symptoms like chest tightness appear on the first day of work after a break and lessen during the week. Other lung diseases include bagasosis, caused by sugarcane dust, and farmer's lung, caused by inhaling mold spores from hay. A previous year's question asks, which occupational lung disease is characterized by Monday morning fever? The answer is bisonosis, due to histamine release causing bronchoconstriction after a break from exposure. Healthcare workers face high risks from biological hazards, categorized as bloodborne, airborne, or direct contact. Examples include hepatitis B, tuberculosis, COVID-19, and MRSA. Needle stick injury is a penetrating wound that may expose workers to body fluids. The rule of 3 feet indicates the risk of transmission: hepatitis B at 30%, hepatitis C at 3%, and HIV at 0.3%. Immediate management of a needle stick injury includes washing the wound with soap and water, allowing it to bleed freely, covering it with a dressing, and reporting to the supervisor. Post-exposure prophylaxis, or PEP, is critical and should begin within 2 to 72 hours. Baseline testing for the source and exposed worker includes HB's AG, anti-HCV, and HIV. For hepatitis B, unvaccinated workers require both HBIG and the vaccine series. Biomedical waste management rules mandate proper segregation using color-coded bins to prevent hazards. The categories are yellow, red, white, and blue. The yellow bin is for incineration, containing anatomical waste, soiled waste, expired medicines, and chemical waste. The red bin is for recycling contaminated plastic items like syringes, IV sets, and gloves. The white container is puncture-proof for sharp waste, including needles, scalpel blades, and surgical instruments. The blue container is for glassware, such as broken glass, vials, ampoules, and metallic body implants. A used blood bag must be disposed of in the yellow color-coded bin because it is classified as soiled waste and requires incineration. Mechanical hazards account for about 10% of industrial accidents. Nurses commonly face ergonomic injuries, leading to musculoskeletal disorders, back pain from lifting patients, and varicose veins from long standing. Preventing back injury involves using good body mechanics. Remember to lift with your legs, not your back. Keep your back straight, bend at the knees, and hold the load close to your body. Use major muscle groups and pivot instead of twisting. Psychosocial hazards affect mental health. They include burnout, characterized by emotional exhaustion, workplace violence, common in emergency departments, and shift work, which disrupts circadian rhythms and sleep. Miner's nystagmus is an occupational disease caused by physical hazards, specifically working in insufficient light conditions in mines, which results in involuntary eye movements. The Factories Act of 1948 includes key health provisions, such as daily cleanliness, proper waste disposal, sufficient lighting, and ventilation providing 500 cubic feet of airspace per worker. Separate latrines and cool drinking water are also mandated. The Factories Act of 1948 also mandates various welfare measures under Sections 42 to 50, including provisions like washing facilities and first aid appliances. The ESI Act of 1948 provides Social Security benefits, including full medical care, sickness benefit at 70% of wages, maternity benefit at 100% wages for 26 weeks, and disablement or dependence benefit for injuries or death. The National Policy on Safety, declared in 2009, aims to recognize a safe working environment as a fundamental human right. Objectives include reducing work-related injuries and enhancing community awareness through law enforcement and skill development. NABH guidelines ensure hospital safety. These include mandatory pre-employment and annual health checkups, hepatitis B vaccination for high-risk staff, and regular training on fire safety and biomedical waste. Reporting of needle stick injuries is also mandatory. For chemical spill management, a spill kit should contain PPE, absorbent material, and neutralizers. The procedure involves isolating the area, wearing PPE, containing and neutralizing the spill, absorbing it, and disposing of it as chemical waste in the yellow bin. In this rapid-fire Q&A, lead poisoning causes a blue line on the gums. Monday fever is byssinosis. The suggested nurse-to-patient ratio in ICU is 1:1, and the most common occupational cancer is skin cancer. Ultraviolet rays cause arc eye in welders. The maximum manual lifting weight for a male worker in India is approximately 50 kilograms. The Factories Act was established in 1948, and bagisosis is caused by inhaling sugarcane dust. Medical prevention measures include pre-placement exams to ensure fitness for the job, periodic examinations for early disease detection, and health education to train workers on PPE use and hygiene. Engineering measures are primary prevention controls applied to the environment, such as substitution, enclosure, isolation, and ventilation. Personal protective equipment is the last line of defense, including respirators and lead aprons. According to the Factories Act 1948, a creche must be provided if a factory employs more than 30 women. The summary checklist focuses on key diseases, waste color codes, and legal acts. Review pneumoconiosis types, radiation effects, needle stick injury management, and waste segregation rules. Key acts include the Factories Act and the ESI Act of 1948. Thank you for watching this video. All the best for your nursing exams.